1. Can you describe your ability to stay organized when performing your nursing duties and responsibilities?
Describing my ability to stay organized while performing nursing duties and responsibilities is like cleaning the surroundings and setting up everything before receiving the endorsement of the outgoing nurse on duties, because it is easy for me to move freely when it's tidy and organized. Then after receiving the endorsement, I always make a to-do list and make sure to do first the things that is necessary and prioritize the patient that needs immediate care. I always prioritize my patients depending on their level of care. Time management is also important to me when performing nursing duties and responsibilities. I always make sure that all of my patients are in good situations and that I provide quality care for each of them. Being organized can easily access and analyze procedures designed to handle various problems when they arise.
2. What would you do if you saw a healthcare worker administering oral medications without washing their hands?
If I observe healthcare professional giving oral medication without first washing their hand, I will swiftly draw their attention, speak with them privately, and emphasize the importance of hand hygiene prior to giving oral medication. I'll make sure that they know that hand cleanliness is a wonderful way to avoid infections, and most pathogens that cause severe infections in healthcare are transmitted by people's action.
3. Tell me about a time you stepped into a leadership role.
When there are only 3 nurses and 1 nursing attendant on shift, we occasionally have 2 patients coding at the same moment. I headed the code team while we are waiting for the doctor. I therefore divided the team into half right away. As the team's senior nurse, I set my 2 nurses into the first patient and taking the nursing attendant with me to the other patient. While we wait for the doctor, I called the available respiratory therapist to assist us in resuscitating the patient. Even though we are short-staffed, we still make accommodations to enable things to happen. Fortunately, when the physician came, the patients were revived. We were able to accomplish certain things into success by explicitly outlining the team's structure, identifying each team's member's strengths, and delegating tasks.
4. Describe a time you were faced with a patient who chose not to communicate or disclose important information. How did you handle the situation and what was the outcome?
My patient once withheld some of his medical information, which placed my coworker and me in a bad situation. COVID had just begun at the time, and I've been assigned to the medical ward. The patient and his relatives opted not to inform us that they had been exposed to a COVID-positive patient. Even when filling out the health declaration form upon approaching the hospital grounds, and they lied about their medical history in triage area and provide false information. The patient appears to have all of the symptoms, so I asked him again and his family in the ward if they had any exposure to COVID-positive patients. I advised them that it was important for them to be honest so that we could provide the proper treatment, medications, and interventions for the patient and reassure them that they had nothing to worry about. And when the patient informed us that they had been exposed, I promptly called the doctor on duty, reported it to infection control for contact tracing, and we isolate the patient's room before transferring them into COVID ward. The test result came out positive for the patient and relatives, and also for me and my other coworker. Not providing crucial information puts the healthcare team and other medical patients into danger, particularly when it is infectious or contagious.
5. Describe a moment when you had a patient who was seriously ill and took up much of your time. How did you manage this patient's care while making sure the needs of your other patients were met?
I had the experience of caring for a patient who consumed a lot of my time. I always went into her room first and take care of it to the best of my ability before I left her room. Together with her relative, I explained to her that everything was great and done and that I had other patients to attend to. I promised to check on her again after I finish seeing my other patients. Just call me if something serious occurs. And if I'm with another patient when you call, I'll send out one of my other co-nurses to help you. The patient must understand that you are providing for other patients as well, and they must know and feel that they are being taken care of. Proper communication is necessary.
6. Describe a time when you cared for a patient with values, beliefs, or morals that conflicted with your own. How did the situation affect your relationship with the patient? How does having a diverse workforce benefit the hospital?
I encountered a patient who was a Jehovah's Witness. The patient in the situation requires a blood transfusion due to severe anemia. Blood transfusion is prohibited in their faith, though the medical intervention he required was still described to him and their wife, so they understood that the blood transfusion was the best way to treat his anemia. But in order to honor their belief, I also referred them to the doctor if it was feasible to give him medication that could help blood production rise. I've also given the guy advice on what foods to consume to boost his blood production. Their views of the world, their feeling and psychological health, and even though how they handle their bodies are all influenced by their religious and spiritual beliefs. The variety of cultures enables us to acknowledge and appreciate ways of being that are not always similar to our own, so that we can create links of confidence, respect, and understanding across cultural boundaries as we engage to others.
Thank you for watching.